Greetings, everyone. For today's lecture, we're going to learn more about the fundamentals of nursing. Unit 1, the nature of nursing. Chapter 1, historical and contemporary nursing practice. And for today's lecture, we're going to focus on the criteria of a profession and socialization to nursing. This book from Crochet and Herbs will be our main reference. Okay, so before we discuss the criteria of profession, let us first define what is a profession. So we have here the profession, professionalism, and professionalization. Let's define each. Profession has been defined as an occupation that requires extensive education or a calling that requires special knowledge, skill, and preparation, generally distinguished from other kinds of occupations. Professionalism refers to professional character, spirit, or methods. It is a set of attributes, a way of life that implies responsibility and commitment. And lastly, professionalization. Professionalization is a process of becoming professional, that is, of acquiring characteristics considered to be a professional. Now here are the 7 criteria of a profession, namely, specialized education, body of knowledge, service orientation, code of ethics, ongoing research, autonomy, and professional organization. Let's define each. Specialized education is an important aspect of professional status. In modern times, the trend in education for the professions has shifted towards programs in colleges and universities. Many nursing educators believe that the undergraduate nursing curriculum should include liberal arts education in addition to the biologic and social sciences and the nursing discipline. In the United States today, there are 5 means of entry into registered nursing: hospital diploma, associate degree, baccalaureate degree, master's degree, and doctoral degree. Next is the body of knowledge. As a profession, nursing is establishing a well-defined body of knowledge and expertise. A number of nursing conceptual frameworks contribute to the knowledge base of nursing and give direction to nursing practice, education, and ongoing research. Next is service orientation. A service orientation differentiates nursing from an occupation pursued primarily for profit. Many consider altruism or selfless concern for others the hallmark of a profession. Nursing is a tradition of service to others. This service, however, must be guided by certain rules, policies, or codes of ethics. Today, nursing is also an important component of the healthcare delivery system. Nurses have traditionally placed a high value on the worth and dignity of others. The nursing profession requires integrity of its members. That is, a member is expected to do what is considered right regardless of the personal cost. Ethical codes change as the needs and values of society change. Nursing has developed its own codes of ethics and in most instances has set up means to monitor the professional behavior of its members. Increasing research in nursing is contributing to nursing practice. In the 1940s, nursing research was at a very early stage of development. In the 1950s, increased federal funding and professional support helped establish centers for nursing research. Most early research was directed at the study of nursing education. In the 1960s, studies were often related to the nature of the knowledge base underlying nursing practice. Since the 1970s, nursing research has focused on practice-related issues. Now, on autonomy. A profession is autonomous if it regulates itself and sets standards for its members. Providing autonomy is one of the purposes of a professional association. If nursing is to have professional status, it must function autonomously in the formation of policy and in the control of its activity. To be autonomous, a professional group must be granted legal authority to define the scope of its practice, prescribe its particular functions and roles, and determine its goals and responsibilities in delivery of its services. To practitioners of nursing, autonomy means independence at work, responsibility, and accountability for one's actions. Autonomy is more easily achieved and maintained from a position of authority. For example, all states have passed legislation granting nurse practitioners supervisory, collaborative, or independent authority to practice. And currently, 27 states do not require physician oversight of nurse practitioners to practice, according to Selway in 2012. Now, operation under the umbrella of a professional organization differentiates a profession from an occupation. Governance is the establishment and maintenance of social, political, and economic arrangements by which practitioners control their self-discipline, their working conditions, and their professional affairs. Nurses, therefore, need to work within their professional organizations. The ANA, or the American Nursing Association, is a professional organization that advances the nursing profession by fostering high standards of nursing practice, promoting the rise of nurses in the workplace, projecting a positive and realistic view of nursing, and by lobbying the Congress and regulatory agencies on healthcare issues affecting nurses and the public. So you can remember the criteria of profession by using the acronym SPED-BSCREP. So this is not a literal meaning, but SPED with scrap stands for specialized education, B for body of knowledge, S for service orientation, C for code of ethics, R for research, A for autonomy, and P is for professional organization. Now we discuss about the socialization to nursing. The standards of education and practice for the profession are determined by the members of the profession, rather than by the outsiders. The education of a professional involves a complete socialization process, more far-reaching in its social and attitudinal aspects and its technical features than is usually required in other kinds of occupations. Being a nurse isn't a one-man's job. You need help of as many as possible. There are certain aspects of nursing that needs the assistance of others. So first, let's define what is socialization. Socialization can be defined simply as a process by which people learn to become members of groups of society and learn the social rules defining relationships into which they will enter. Socialization involves learning to behave, feel, and see the world in a manner similar to other persons occupying the same role as oneself. The goal of professional socialization is to instill in individuals the norms, values, attitudes, and behaviors deemed essential for survival of a profession. Various models of the socialization process has been developed. And for this lecture, we're going to focus on Benner's 5 stages of nursing experience. Benner's model describes 5 levels of proficiency in nursing based on the Dreyfus general model of skill acquisition. Benner writes that experience is essential for the development of professional expertise. For stage 1 is called novice. It means no experience such as a nursing student. Performance is limited, inflexible, and governed by context-free rules and regulations rather than experience. Second stage is advanced beginner. It demonstrates marginally acceptable performance that recognizes the meaningful aspects of the real situation, has experienced enough real situations to make judgments about them. Third stage is competent. It has 2 or 3 years of experience, demonstrates organizational and planning abilities, and differentiates important factors from less important aspects of care and coordinates multiple complex care demands. Fourth stage is called proficient. Proficient has 3 to 5 years of experience, perceives situations as a whole rather than in terms of parts, uses maxims as guides for what to consider in a situation, has a holistic understanding of the client which improves decision making and focuses on long-term goals. And lastly is the expert. An expert performance is fluid, flexible, and highly proficient. It no longer requires rules, guidelines, or maxims to connect an understanding of a situation to appropriate action. It demonstrates highly skilled intuitive and analytic ability in new situations. It is inclined to take a certain action because it felt right. So you can use the acronym NACPE. NACPE stands for Novice, Advanced Beginner, Competent, Proficient, and an Expert. One of the most powerful mechanisms of professional socialization is interaction with fellow students. Within this student culture, students collectively set the level and direction of their scholastic efforts. They develop perspectives about the situation in which they are involved and goals they are trying to achieve, and the kinds of activities that are expedient and proper. And they establish a set of practices congruent with all of these. Students become bound together by feelings of mutual cooperation, support, and solidarity. The NSNA, or the National Student Nurses Association, helps link nursing students with nursing leadership groups. This organization exposes student nurses to issues impacting the nursing profession while promoting collegiality and leadership qualities. It is within the nursing educational program that the nurse develops, clarifies, and internalizes professional values. Specific professional nursing values are stated in the Nursing Code of Ethics, in Standards of Nursing Practice, and in the legal system. Additionally, in 2001, the NSNA adopted a Code of Academic and Clinical Conduct. Okay, so here are code for nursing students. Let's see each of this. As students are involved in the clinical and academic environments, we believe that ethical principles are a necessary guide to professional development. Therefore, within these environments, we advocate for the rights of all clients, maintain client confidentiality, take appropriate action to ensure the safety of clients, self, and others, provide care for the client in a timely, compassionate, and professional manner, communicate client care in a truthful, timely, and accurate manner, actively promote the highest level of moral and ethical principles, and accept responsibility for our actions. Promote excellence in nursing by encouraging lifelong learning and professional development. Treat others with respect and promote an environment that respects human rights, values, and choice of cultural and spiritual beliefs. Collaborate in every reasonable manner with academic faculty and clinical staff to ensure the highest quality of client care. Use every opportunity to improve faculty and clinical staff understanding of the learning needs of nursing students. Encourage faculty, clinical staff, and peers to mentor nursing students. Refrain from performing any technique or procedure for which the student has not been adequately trained. Refrain from any deliberate action or omission of care in the academic or clinical setting that creates unnecessary risk of injury to the client, self, or others. Assist the staff nurse or preceptor in ensuring that there is full disclosure and that proper authorizations are obtained from clients regarding any form of treatment or research. Abstain from the use of alcoholic beverages or any substances in the academic and clinical setting that impair judgment. Strive to achieve and maintain an optimal level of personal health. Support access to treatment and rehabilitation for students who are experiencing impairments related to substance abuse and mental or physical health issues. Lastly, uphold school policies and regulations related to academic and clinical performance, reserving the right to challenge and critique rules and regulations as per school grievance policy. So remember that as a nursing student, before being a professional, we must now learn from our heart that we do all of this and we put it our hearts the code of nursing because we wanted to protect the public. All of these are for the public protection. Okay, as a summary, we talked about the criteria of a profession and socialization to nursing. We define profession, professionalism, and professionalization. So remember, profession is an occupation, professionalism are set of attributes, and professionalization is the process of being a professional. We also talked about SPECS-B-SCRAP, or the criteria of a profession. It stands for specialized education, which includes diploma and degrees. B for body of knowledge. These are the frameworks to improve the nursing education and practice. S stands for service orientation, or the altruism or being selfless. C stands for code of ethics, which gives importance to dignity and integrity as a nurse. R for ongoing research. A for autonomy, or being independent, responsible, and accountable for your actions. And P stands for professional organizations such as the American Nurses Association. We also talked about Benner's NACPE, or the stages of expertise in nursing. NACPE stands for novice, advanced beginner, competent, proficient, and expert. And we also talked about the NSNA, or the National Civil Nurses Association, and its code of conduct, and the critical values of nursing. Remember calls, the code of ethics, legal system, and the standards of practice. For the next discussion, we're going to focus on the factors influencing contemporary nursing practice. Thanks for watching.